Tackling drugs, starting with E.
Ooh, fun.
You got a fantastic source for this one. A podcast by Dr. Khaled Hasan.
Oh, yeah, he's great.
He's a clinical pharmacologist and clinical researcher. And he really breaks down each drug, generic name, brand name, the clinical use. And some of these uses I think are going to really surprise you.
Looking forward to it.
Okay, so let's jump right in. First up, we've got Eletriptan, also known as Relpax. And Dr. Hasan classifies this as an anti-migraine drug.
Interesting.
So I know what a migraine is.
Sure.
But a drug specifically for migraines, that's kind of wild.
Yeah, migraines, they're not your average headache.
Right.
There's a lot of complex neurological stuff going on there. And so Eletriptan, what's interesting is it targets a very specific serotonin receptor.
Okay.
In the brain, it's called the 5-HT1B receptor, if you want to get technical. But basically, that receptor plays a key role in those migraine attacks.
So it's not just like numbing the pain, it's like stopping the migraine from happening.
Exactly. It interrupts the process.
Wow, that's incredible. Okay, so let's switch gears completely.
Okay.
We've got Emtricitabine, which is part of the combination drug Atripla. And this one is an antiretroviral drug, which of course is critical for managing HIV.
Yeah, antiretrovirals, essentially, they suppress the replication of HIV. So in the case of Emtricitabine, it's what's known as a nucleoside reverse transcriptase inhibitor.
Wow.
Or NRTI for short. But basically, it stops the virus from making copies of itself.
So it can't spread.
Exactly, helps control the disease.
I remember when HIV was like a death sentence.
Yeah.
It's amazing how far we've come with these medications. Speaking of life-saving drugs, let's move on to Enalapril.
All right.
Also known as Apand or Vasotec. This is an ACE inhibitor. And Dr. Hasan says it's used for a whole bunch of cardiovascular conditions.
Yeah, ACE inhibitors are really versatile. They block the angiotensin converting enzyme, which helps to relax and widen your blood vessels. So that lowers blood pressure, great for hypertension. But it also improves blood flow, reduces strain on the heart. So it's used for heart failure, even in some cases of kidney disease.
Wow. One drug, so many uses.
Yeah.
Okay, next up we have Enoxaparin.
Okay.
Brand name, Lovenox. And Dr. Hasan categorized this as a low molecular weight heparin. Now, I know heparin is a blood thinner.
It is.
But what makes this one special?
Well, enoxaparin is derived from heparin, which is actually a natural substance.
Oh, wow.
It's found in the body, but it's modified for easier use. And what really stood out to me in Dr. Hasan's podcast was its efficacy in preventing those deep vein thrombosis.
Like blood clots?
Yeah, especially after surgery. He cited studies showing a significant reduction in clot formation compared to other types of heparin. It can be the difference between life and death.
Wow, so there are different types of blood thinners.
Oh, yeah.
It's a whole world. All right, let's dive into the nervous system now. We've got Entacapone, which is a component of the drug Stalevo 50. And this is classified as an anti-Parkinsonian medication.
Okay, so Parkinson's disease, it involves the loss of dopamine-producing cells in the brain.
Right.
Which leads to those movement problems. And Entacapone, what it does is it inhibits an enzyme called COMT, which normally breaks down dopamine.
So it's protecting the dopamine.
Exactly. It boosts the levels of dopamine available to the brain.
So it's giving the brain a little extra help.
Yeah, you could say that.
But wait, if it increases dopamine, couldn't it be used for other things besides Parkinson's?
That's a good question. And you're right, dopamine plays a role in a lot of brain functions, mood, motivation, all sorts of things. But Entacapone is specifically designed to target the areas affected by Parkinson's.
Okay.
So it might have some effects elsewhere, but its primary use and FDA approval is for managing those Parkinson's symptoms.
That makes sense.
Yeah.
Okay, switching gears again. We come to Epoetin alfa, also known as Epogen. And Dr. Hasan describes this as a human erythropoietin. I'm not even going to try to pronounce that.
It's a mouthful. What does that even mean?
Don't let the name scare you. Erythropoietin is a hormone that your kidneys naturally produce.
Okay.
It stimulates red blood cell production. And red blood cells, those are crucial for carrying oxygen throughout your body.
Right, of course. So epoetin is like a synthetic version.
Exactly.
And it's used to treat anemia.
Right, which is a shortage of red blood cells.
So it's like giving your body's blood-making system a boost.
Yeah, that's a good way to put it.
I'm noticing a theme here. A lot of these drugs, they seem to be like mimicking or supplementing substances that our bodies already make.
You've hit on a key point. A lot of medications work that way. Replacing something that's missing, enhancing its production or blocking its action.
It's like fine-tuning the body.
Exactly. The human body is a complex machine.
Speaking of fine-tuning, let's talk about Escitalopram.
Or Lexapro. This falls into the category of SSRIs,
Okay.
which are commonly prescribed antidepressants.
SSRIs stand for selective serotonin reuptake inhibitors. They increase serotonin levels in the brain. Serotonin is a neurotransmitter that plays a big role in mood regulation. And Dr. Hasan mentioned that Escitalopram specifically is often praised for its relatively low side effect profile compared to some of those older antidepressants.
Interesting. I've heard a lot about SSRIs in general, but it's good to get that specific detail about escitalopram,
Okay.
from mood to digestion.
All right.
Our next E drug is Esomeprazole, brand name Nexium. And Dr. Hasan classified this as a proton pump inhibitor.
So proton pump inhibitors, or PPIs for short, they're really good at reducing stomach acid production. It's like turning down the volume on your stomach's acid pumps. Is there a go-to treatment for heartburn, GE, or D? Even ulcers, anything caused by too much stomach acid.
Yeah, I know a lot of people who rely on PPIs. It's amazing how common digestive issues are.
It's true.
Okay, from stomach troubles to sleep troubles. Let's talk about Eszopiclone, which goes by the brand name Lunesta. This one, Dr. Hasan classified it as a Z drug.
The Z drug.
Yeah, I've never heard of that before.
So Z drugs are a newer class of hypnotic medications,
Hypnotic.
meaning they help you sleep.
Yeah.
They work by binding to certain receptors in the brain, promote relaxation and sleepiness. So Eszopiclone, it's often prescribed for insomnia, helps people fall asleep faster and stay asleep longer.
Yeah, I can see why that would be helpful. Insomnia can be really tough. Okay, for our next drug, we're going into the world of immunology.
Okay.
Etanercept, or Enbrel. This is what Dr. Hasan called a DMARD.
DMAR.
Yeah, a disease-modifying anti-rheumatic drug.
Now, those are some serious drugs. They can actually change the course of autoimmune diseases,
Really?
like rheumatoid arthritis. Etanercept specifically targets a molecule called TNF-alpha, which plays a key role in inflammation by blocking TNF-alpha. Etanercept reduces joint pain, swelling, and damage.
So it slows down the disease.
Exactly, a game changer for people with rheumatoid arthritis.
Wow. It's incredible how we can target such specific immune responses with medicine. Okay, moving on, we have a combination drug,
Okay.
ethinyl estradiol and drospirenone, better known as Yaz.
Yes.
And this falls under the category. Finally, we have Ezetimibe,
Okay.
or Zetia. Dr. Hasan classifies this as an anti-hyperlipidemic.
So anti-hyperlipidemics are all about lowering cholesterol. You've probably heard of statins.
Yeah.
Very common. Ezetimibe works a bit differently. It blocks the absorption of cholesterol in the intestines.
So it stops it before it even enters the bloodstream.
Exactly.
That's so clever. I never realized there were so many ways to manage cholesterol.
There are a lot of options these days, and that's what makes exploring these e-drugs so fascinating.
It is.
It highlights the range of conditions we can treat, the ingenuity of drug development, the constant search for better ways to manage human health.
Couldn't agree more. A huge thank you to Dr. Khaled Hasan for the amazing source material. It's really inspiring to see the dedication and innovation in the world of pharmaceuticals. And to our listeners, we hope this deep dive has sparked your curiosity about the medications we rely on. Who knows what amazing discoveries are just around the corner? Thanks for joining us.